favorite. The Baucus bill clears a hurdle in the Senate Finance Committee, but the hard work may just be starting as competing versions of the health care bill must be merged into one. Republican Senator Mike Crapo of Idaho is a member of the Senate Finance Committee. He voted no on the Baucus bill. It joins me this morning from Capitol Hill. Good morning, Senator. Good to see you.
Good morning.
You had some serious objections to this bill. What were they?
Well, first of all, people in America want to see health care costs brought down and see access to reasonable and high-quality health care increased. This bill will achieve neither of those two results. The fact is that it's going to be a massive increase in spending at the federal level, major intrusions of the federal government further into management of our health care economy, and over $500 billion in new taxes, most of which will be borne directly by the middle class. This is the wrong direction we should be taking with health care reform.
Senator Snowe said yesterday, in a surprise to many of you and your colleagues, is this the bill that I would want? Far from it. Is it all that it can be? No. But when history calls, and I happen to think that the consequences of inaction dictate the urgency of Congress to take every opportunity to demonstrate its capacity to solve the monumental issues of our time. Do you not feel that burden too, Senator?
Well, I feel the urgency to move forward with the right solutions, but believe me, doing the wrong thing because of the urgency is not going to help our country. And as I've indicated, it's the wrong direction that this bill is taking. And in fact, even as we are speaking, it's being merged with the Kennedy bill from the Help Committee. And that bill, that merger will undoubtedly move it further in the wrong direction in terms of more government control, more spending, and more taxing. What we need to be doing is solving the problems of the spiraling costs of health care. And we know how to do that. We know many things that can help get that done. And we need to be expanding the access for those who are uninsured or underinsured in ways that don't involve government takeover of the economy.
Senator, there are as many as 5 bills. The question everybody's asking is, will the merger of the finance and health care bill likely wind up in the public option being included? Do you think it will, or do you think it will not?
Well, I think there's a very real chance that it will move closer to a public option, although I don't believe a pure public option will be able to pass in the Senate. So what I think is likely to happen is, yes, the bill will move further and further toward more and more government controls, and may even contain what's called a trigger, which is to establish a government option but not implement it until certain triggered targets are met. And if that happens, it's simply a matter of time before the public option is imposed. But those who don't support one can claim that it wasn't actually in the bill at the outset.
So based on the bills right now sitting before us, there is not one bill that you will vote for?
Not for the bills that are moving through the committees. There are a number of bills out there that I would support, and a number of good ideas, like expanding the insurance pools, allowing competition across state line for insurance, increasing the opportunities for small businesses to pool together and negotiate with strength for the policies that they provide. A number of other reforms in terms of changing the payment system in our healthcare system from a focus on procedures to a focus on outcomes. Things like that we have learned can actually truly bend the cost curve down.
All right, Senator Mike Crapo of Idaho, I thank you very much for taking the time to join us this morning. Good seeing you.